IDD Caregiver Voices is based in North Carolina. IDD Caregiver Voices is intended to be a place where family caregivers of adults with IDD, that is, adults with intellectual and/or developmental disabilities, who require a level of care that translates into, quote, those who forever and always will be in the care of others, end quote, will be able to have their voices heard in response to the proposed and/or implemented changes to government programs and services that are, to use government language, quote, medically necessary for the health and safety, end quote, of the adults they care for. We are family caregivers who understand the concept of personal responsibility. If we had the skills and/or talents to live our lives with our adults with IDD without taxpayer dollars, that would be our first choice. However, we find ourselves caught in a system that has made our adults with IDD dependent on taxpayer dollars. We are family caregivers who clearly understand that taxpayer dollars are not government dollars, but are truly dollars taken from a real person's wallet. We will try to always use the term taxpayer dollars instead of tax dollars in order to show our respect for taxpayers. We are family caregivers who have been left out of the process that governments use for designing and implementing services and supports for adults with IDD. We are not invited to the table as stakeholders unless we are willing to travel to our state capital. We are family caregivers who have watched as the so-called traditional advocacy groups, such as the ARC, UCP Easter Seals, epilepsy, and/or various autism groups, have become direct service providers, funded primarily with taxpayer dollars. We are family caregivers who are aging and see no system, private or public, that is planning for the future time when we will be unable to provide care. We only see workforce development programs that are being designed to develop workforce for the aged. We are family caregivers of adults with IDD who now have a place for our voices to be heard.